So I'm Grant Schmid, Senior Director of Sales for Topcon Healthcare Solutions. So today we're going to be talking about new products, new things that Topcon's been working on. So we're really working together to build products that the market's actually needing. So in the past, there's been a big drive in the ophthalmology space of sometimes products are made before they've asked anybody if they wanted them. And we're trying to change that. We're trying to change things around and design things that are revolutionary, that are faster, that are better, but also that people are looking for. So we're taking a different approach to it. We're creating the Topcon Healthcare Suite, and so we're building a platform. That platform has multiple applications on it, but it starts with data management. And so those platforms are meant to be able to allow multiple Topcon instruments, as well as third-party instruments and third-party software to pull into this ecosystem, as well as clinical applications, and then standard communication methods like HL7 and DICOM. THS. So this is what the platform looks like. This is where everything's coming together. You can see we've got Topcon Cloud. It's a new way to back up your instruments. It's a lot like with your phones where you pay $2.99 a month and it backs your phone up to the internet. This is the same thing for our Maestros, for our Tritons. It allows things to upload to the cloud, so if an instrument fails, we have the potential to be able to ship you a new instrument with your data already on it. Data management, some of these other suites that we're working on right now is all about the platform. It's about putting things together, making instruments work and communicate better. So, and pulling those all together. What it says, acquisition to determination. So it's really about how can we acquire that data, and it's not just the images, it's the data. How can we pull that all together into one application and allow you to manage that data to more effectively see patients and treat patients. So this is where we're going to talk about the new data management system called Harmony. But before I jump into that, I want to just tell you really briefly about Topcon Healthcare Solutions. Topcon Healthcare Solutions was created almost 2 years ago with the intent of developing software and to be a software business. Within software, things have to happen much, much faster and be more dynamic. And as part of that, we've grown from 4 employees 2 years ago to about 140 employees globally, with offices in Singapore, in Finland, in the US, in Europe. And it's constantly growing and we're moving things along. As part of that, this Harmony system that we developed recently is based on material design. And what's really amazing about that, I talked about moving things faster, about moving the product faster, is we actually completely redesigned the application in August. So if you think about that, this is a pretty serious application. There's a lot of work that goes into that. And in August, we decided material design needed to be a part of that. And so within 2 months, we completely rewrote the interface. So material design, what is that? So material design was actually developed by Google. So Google developed this idea, how do we develop in a way that doesn't require a manual? How do we develop software that's an industry standard? And what's interesting about that is Apple followed them. If you're using an application right now, most of your applications you're using follow material design. If you've seen 3 vertical lines or horizontal lines, that's the hamburger menu. And that's something you'll see in most of your applications, and that's something you'll see actually in Harmony. Because the goal, again, is to be able to deploy this in a way that you don't need end users to learn how to use it. It's intuitive for them to move through that. So to show you how that change happened, we've actually done some before and after. So this is what our software looked like in March. And what happened in March is we looked at this and we said, wow, I think there's 4 different colors of orange on there, 4 different shades. And it was a good system. There wasn't anything necessarily wrong with it, but when we applied material design to it, you can see a drastic effect. Look at how much easier it is to see those images. By pulling all those other colors out, by reducing the number of buttons, we've moved to an agile development, we've moved to the ability to look at every button in here and be able to run reports against those and say, how often are those being used? And that's important because when you're talking about material design, when you're talking about functionality, you don't want a button in your system that nobody's using because it just gets in the way and it's something someone has to ask a question about. So we're very cognizant of what's in the system and how can we minimize it, which is again a different feature. There's, in Microsoft products, if you use Word or Excel, there's way more features in that product than you'll ever use. And what happens with that is sometimes there's too many products and it makes it harder to use. So what we're attempting to do in here is find a way to put the minimal amount needed while still giving you rich functionality and make it so that it works very well for your system. If you see again here, here's Funnest review. This one's much more apparent, especially when you see the orange colors in here. So you can see that these images, they're readable. There's not a problem reading those, but when I jump into this new view, look at how much more those images stand out, how much easier it is to see those. Within our software, we still have all the functionality of the Funnest review. We can change color, we can change contrast, we can do measurements, PDT to cup, linear measurements, we can put notes on these. And so where I was talking about minimizing features, we're minimizing features that you may never use. So that's again where we track the functionality of the product and decide what's the best way to use these things. Another feature that's really interesting that we put into the software is you can see right here, there's actually a picture of the patient themselves. And where this becomes really helpful is many times doctors are walking into an exam lane and there's 4 or 5 people in that room. And they have no idea who the patient is because the patient isn't the one sitting on the table. And so having the picture of the patient before they walk in is tremendous because now the doctor knows who to say hello to. And we need to remember that in medicine, being personal is still a really important thing. Patients like to know that this person who's going to operate on them knows who they are. And they get that warm feeling just like sales. And a doctor in some ways is selling their service to these patients. And so that's a huge feature that really has zero clinical value. But we realize that there's an importance there. So when we've built these things, a part of that is we've built disruptive pricing into this as well. So what Topcon is attempting to do is be disruptive. And when we say disruptive, we're not trying to be, the kid that makes it you can't hear the movie, kicking the seat and making noise. We're trying to be disruptive in a way that we're improving the industry while thinking outside the box. And it's very, very difficult to do. Probably the hardest thing to do is make something simple. That's one of the hardest things you can do. And so we're trying to actually make our pricing simple and make our product disruptive. As part of that, you can see how easy this is. We now no longer charge for devices. Devices are unlimited. We're going to connect any device as long as we can connect it, we're going to pull it into your system. You can see for a single provider, $299 a month. That's very, very easy. It's $299 a month, includes 3 users, 1 location. You can add a user for $99. Unlimited instruments that we said before, we'll connect your EMR and we'll provide hardware if it's needed. But that's a total change. That's totally disruptive in what's happening in the industry right now. Normally, if you go to buy an image management system, whether it's in radiology, whether it's in ophthalmology or other groups, it's a very complicated process. We now just made it very easy. And I can tell you, it took a lot of work to make it this easy, to figure it out. But it's exciting, and we're starting to see many people gravitating to this and moving onto this platform because we have made it easier for them. Now I'm going to jump into the product itself and give you a quick tour of it. So one thing that's interesting about the way you design the software is that it is an HTML5. Because it's an HTML5, that means it's browser independent. It doesn't matter what browser you have, whether you're Chrome, Safari, Firefox, if you still have Internet Explorer, but it will work in that as well. It's going to work on all those platforms. It's going to work on an Apple tablet. It's going to work on an Android tablet, and it's responsive to the platform. So what that means is it redesigns itself based on the platform you're using it on. You'll also notice that all the buttons are in the right shape to be able to use for touch. And so that's another important thing because we realize in the current world we're in, everything's moving more and more to mobile devices. I think the cell phones are getting bigger and bigger, which is concerning to me. I don't know how you fit them in your pockets, but everything is moving to that platform. It's moving to a way to be able to use it in a mobile environment. What I'm showing you right now is actually called our timeline. Timeline is a new feature that was developed through some feedback of our customers and as well as some ingenious design from our developers in-house, coming up with a way where I was talking about disruptive. This is a new way to view the patient chart. We've actually patented this right here. So this view called the timeline has a patent pending on it. But what it is I'm in this patient. You can see the patient up here at the top. It says Robert. Within this patient, I can do a couple different things. I can actually click on, if I can get my mouse to do it for me, come on. Mouse is jumping around. Let me move this a little bit closer. I think my laptop's behind. Let's see if that makes it better. So if I click on the spectralis here, it'll actually open up every spectralis. And so in one click, I can see one type of instrument right off the bat. If I click that again, it goes away. I can also come in here and I can say I want to look at just the spectralis for that date, and then I want to look at maybe an ultrasound here, or that's an OCT, whoops. Here's the ultrasound right below it. I want to look at the ultrasound. I can take the OCT away. Actually, I'm looking at Cirrus. It's hard to see sideways, but here's Funnest image. So you can see I can just select different types of tests and pull them across the bottom. Once I pull those across the bottom, I can now come in here and I can say, well, I want to look at this one, and I want to look at this one, and I'm just selecting random ones right now, and I want to look at this one, and then I'm going to compare those to each other. So now I'm looking at 3 different tests pulled together. I've got my OCT, it's pulling all the slices together, and we're on a Wi-Fi network here, so it's a little slow, but you can see I'm pulling through those slices. Now our team has done a lot of work on those OCTs to make them scroll very seamlessly and to move through them, and that's a lot of work on those to make that a fluid movement so that you can see changes there. But what you're also going to notice is I just showed you 2 devices from 2 other manufacturers besides Topcon. So here's Spectralis, here's Zeiss, here's Topcon. The reason I do that is I want you to understand that this is a vendor-neutral platform. We've built the software to stand on its own. We could easily make it work better with Topcon devices, but we chose not to because we realize that everyone has a choice, and sometimes they make a bad choice and they buy something that's not Topcon, but we don't want to punish you for that. And so we make our software work with everyone. And we realize that there are other pieces of software out there, and we're not always the first to develop new technology. So it's important to have technology, the ability to bring new technology into your practice and not have to worry about who made it. So we pull all that in. The other part of it's really important to remember is devices are changing much more rapidly than they did in the past. It used to be that you bought a visual field and you kept it for 30 years. That doesn't happen anymore. Devices have about a 5-year lifespan now, and they're being replaced with something that's newer technology. When you have a platform like this, all of that historical data is now in your platform, and it makes it a lot easier to move from one instrument to another instrument and swap that out. In the past, there'd be a day or two of someone with a USB hard drive backing up data and then moving it to the new system, and then teaching you how to use it. With this, you unplug one, plug in the other, and away you go. You can see I can zoom in on these images, I can zoom out. I talked about color and contrast. If I go back here, I'm going to go back out of this really quickly, and I'm going to pull up just this one. So I can also double click on one test, or I can double click on one dot and pull up that test, but we also have this feature here called historical comparison. Historical comparison is probably one of our best features that we built. We understand with electronic medical records and other systems you're using, clicking is a problem. I've heard in NextGen and some other systems, it can be 20 to 100 clicks per patient to get through a chart, just for one encounter. With this, I can click one time, and when I click one time, it's going to go find the last visit for this patient. So very, very quickly, or the last visit for this patient for that test. So this could be a visual field, this could be an OCT, this could be a Funnest exam, it doesn't matter. As soon as I push that button, go find me the last test for that eye for that patient and pull it up side by side. It makes it really, really seamless for this patient. So what you can also see is there's not a lot of space being, you're not being, I call it screen pollution. You don't have a lot of screen pollution here. There's not a lot of extra on here that's taking you away from doing what you want to do. You can see down at the bottom that you can still see more tests. I can still come in here and click here, and I can see if there's other tests available. We built the system in a way that there's 3 or 4 different ways to do everything. And that would seem like a lot of extra work. Why would you build 3 or 4 different ways to review images? And the reason we did that is we know every doctor's a little bit different. Every doctor has a different way they like to practice. So we make it so that you can move through those images in a lot of different ways. So I've moved a little quickly through this. Do we have any questions on the system? Any questions on how it works or if it would work in your practice? We work with, I think it's 43 different EMRs. It's quite a few number. I like to make the number bigger every day, but that's because I'm in sales. But we do work with a lot of other EMRs, and the goal of that is we understand EMRs change, vendors change, and the last thing you want to do, a lot of people are saying, well, why don't I put my images in the EMR? And that's a big problem, because if I put all my images in EMR and the EMR changes, it's bought or sold by another company, what do I do now? How do I get those images out? Everything we do is stored in DICOM. DICOM is a universal format. It's been around for 30 years. It's used by us, it's used by Heidelberg, by Zeiss, all of our major competitors, and it's also used in radiology for the last 30 years. By using DICOM, it allows us to send the demographic information from the EMR directly to the instrument or directly through our system. A huge advantage you have there is when we're connected with the EMR, we can tell that EMR, send us all the patients you have right now, and we're going to populate our system. And then what happens is we do what's called a work list, and we'll send the demographic information to the instrument when it's requested. If an instrument takes an image and sends a report to us that doesn't include a patient that they've already received from the EMR, it holds it off to the side and says this doesn't match. So what we're now doing as well is we're cleaning up the data, because what we've seen in a lot of practices is many times a physician has to get up and leave the room because they're going in and they're saying, you know what, if I go back here, let me go back to my timeline. Within the timeline you can see, if it'll let me jump back, this mouse is a little jumpy for me, but within the timeline, I'll try that later. Within the timeline, it's showing you all the different dates, and sometimes the physician's in the room and he's saying, hey, I'm missing a test. Where is that test? And it's either, it was used, it said Mary Smith, and now it's Mary B. Smith, so it's 2 different patients, or it was taken under the wrong patient. Or sometimes we've seen on Humphrey Visual Fields that the patient's done 4 different ways, and now not only are you losing the progression analysis software or the advanced features of that instrument, but you're dealing with, at this point, trying to review multiple patients to each other, which doesn't make sense. And so by having that functionality of that communication with the EMR, we allow a lot cleaner data to be in the system. So with that, I'm going to end my presentation. If you have more questions, we have demo systems at the front and over at the side. We'd be more than happy to show this to you. We've just launched Harmony here at Academy. It's an exciting time, but we also are launching it in Europe right now. We have installs in Europe already on our Harmony platform. We have Australia, and we're looking at very quickly going into Latin America. So this is not just a US product. This is something that we're looking as a global product. I appreciate your time today, and thank you.